Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Overwhelming post-splenectomy infection, and in short it is known as a OPSI. So this is MC, that is the most common fatal infection of the following the splenectomy. Most fatal infection, and this is following the splenectomy. And there are certain components known as the opsonins. So there are components such as the opsonins, and these opsonins are attached to the encapsulated organisms. So they are attached to the encapsulated organisms and they are delivered to the spleen. So they are delivered to the spleen, and where the uptake is facilitated by the receptors present on the surface of the splenic phagocytes. So they are done by the receptors present at the splenic phagocytes, on the surface of the splenic phagocytes. And after splenectomy, what is happening is this defense mechanism is lost, leaving the particle susceptible. So after splenectomy, what we are seeing is this defense mechanism is lost. So this defense, so the defense mechanism, so this is totally lost, and this leaves the patient susceptible to the infections of the bacteria. So this makes it the infection very prone to the infections. Now let's look at the most common. So this is most common within 2 to 3 years of splenectomy. So this is within the 2 to 3 years of splenectomy. It is very common. Now what can be the causative agents of this? So when you're looking at the causative agents, so causative agents, it can include the capsulated organisms. So mainly it is capsulated. So this can include the Streptococcus pneumonia. So strep pneumonia, this is the most common. Pneumonia, this is the MC, that is the most common. Next is the H influenza, as well as the Neisseria, gonorrhea, then the Streptococcus species, strep, as well as the salmonella, as well as the capnocytophagia, canimorsus, as well as implicated in the OPSI as a result of the dog bite. So this is as a result of the dog bite. So what are the clinical features? So when we look at the CF, that is the clinical features, it includes the prodromal features. So what do you mean by the prodromal? Prodromal means it can be fevers, it can be chills, the sore throat, as well as the malaise, and the diarrhea and vomiting. So fever, there is chills, sore throat, malaise, then diarrhea and vomiting. Next is the presence of the rapid progression to hypotension. So rapid progression to the hypotension, and there is disseminated intravascular coagulation. There is DIC, disseminated intravascular coagulation. There is also RD, standing for respiratory distress. There can be coma as well as death. This is within hours of the presentation. Next is the high grade of bacteremia with no identifiable focal infection. So there is high grade. There is presence of the high grade, and this is high grade bacteremia. So high grade bacteremia, and there is no identifiable foci of infection. So there is no identifiable foci of the infection. Next is the poor response to the antibiotics. There is poor response. So there is poor response to the antibiotics. Next, we look at in terms of the elective splenectomy. So in terms of this elective splenectomy, so if an elective splenectomy is planned, so if this is planned, a prophylactic vaccination against the pneumococcus, meningococcus, and H influenza should be given. So the prophylactics of against the pneumococcus. So against the pneumococcus as well as the meningococcus. Meningococcus C. So that is both is repeated every 5 years. So both is repeated every 5 years. Next is also the presence of the H influenza. So it is the H influenza and this will be the type B. So H influenza type B, that is the HIB. So they must be given at least 2 weeks before the elective surgery. So it is at least given at least 2 weeks. 2 weeks prior distance to the elective surgery. So in terms there is an emergency splenectomy. So in case of an emergency splenectomy, so here the patient should be vaccinated as soon as possible. So the patients, they should be vaccinated. So they are vaccinated ASAP. So as soon as possible. And this will be after the recovery from the surgery, but not before the discharge from the hospital. This will be after recovery. After recovery and before discharge. And before the discharge. To learn and grow daily like this, please do subscribe.